Welcome to Primary Care Today on ReachMD. I'm your host, Dr. Brian McDonough, and with me is a very special guest, Robert Kreider. He has held the position as Devereux President and CEO since July of 2004. What is Devereux? It's a very interesting organization. I believe you're in 12 states. They deal with people who are battling some challenging issues such as autism, and this is really a topic which is in the news all the time, and Mr. Kreider is going to be able to talk a lot about that. We can talk a little bit about the situation with measles, the vaccine, and a lot of the different controversies surrounding that, so it's really a great time to have him with us. And first of all, Mr. Kreider, welcome to the program.
My pleasure to join you, Brian. Thank you.
A little background on Mr. Kreider. He actually holds his Juris Doctor degree from the University of Pennsylvania and a Master in Economics from the University of Pennsylvania as well. And as I mentioned, he joined Devereux back in December of 1994, and you spent a number of different years in that role. So let me start right away and just talk a little bit about, for the audience who may not know, what is Devereux and what does it do?
Devereux is a 102-year-old organization founded by a Philadelphia school teacher. One of the amazing things is a woman who started an enterprise before women had the right to vote. And over the last 102 years, it grew from a very small school into one of the largest not-for-profit provider of mental health and developmental disability services in the country. You got the number right. We're in 12 states. Our home base is in the Delaware Valley, Philadelphia, South Jersey. Almost a quarter of our services are there. But we are in Florida and California and all through New England. Originally, we're primarily residential services, but almost all our services now are in the community, although we still have campuses in several locations around the country, serving in group homes and on campuses about 2,500 individuals residentially, and more than 15,000 individuals in the community. Again, with mental health issues, and that's mostly kids, but individuals with developmental disabilities, including autism, of all ages.
So let's talk a little bit about, with the kids, the mental health issues. Are we talking about depression, anxiety, those sorts of things?
We're talking about a wide range. We have both the fragile child, or also the conduct disorder, or the very aggressive child. So our services right in the Philadelphia area are sort of a small version of all of Devereux, and they include a small psychiatric hospital for the psychiatric issues that we deal with kids, and residential programs for kids with those challenges. But we also have other campuses where we serve primarily the conduct disordered kids.
Mr. Kreider, when we're talking about conditions like this, I know as a primary care doc who sees patients every day, a lot of these things are very difficult not only to treat for the primary care physician, but it's tough to get the resources and the access to get your patients the care they need in many cases. I know, at least in the community where I practice, it's tough to get psychiatric services. It's tough to get inpatient services are difficult. There's a lot of problems beyond the fact that these are very complicated cases that you really can't see in 15, 20 minutes. It takes time. For primary care doctors who are listening to the program now, what do you suggest? What are the ways, such as Devereux and others, to try to get the assistance that you need?
Well, we're always trying to look forward and look to better days. The idea of integrated care is hopefully going to make some impact in that area. Devereux is trying some demonstration projects and where we would put behavioral resources in primary care physicians' offices to using a public health model, both training the other professionals in the office some basic things to look for in everyone, but then also being available, hopefully in person or by phone, for consultation on more serious issues once they're identified. Those resources are not in place in most places. As you referred to psychiatric time, there is both a shortage of child and adolescent psychiatrists in the United States, but also a very uneven distribution across the country. There are, in general, plenty of child and adolescent psychiatrists in the major cities, much more difficult in more rural environments to even get the attention of a child and adolescent psychiatrist. So it is a challenge.
And when you bring it up, it's interesting. I know, obviously in primary care, we're looking at the patient-centered medical home and trying to have resources, whether it be a dietitian, whether it be a social worker. So the behavioral health clearly plays a very important role. And I'm interested in the fact that you're saying you're kind of not as much in one, beautiful palace. You're spread out in the community, and that would seem to fit the model of what you're trying to do with integrated care.
Absolutely. And the payment models are not quite there yet to make this work. But we think as people get into more capitated arrangements, our proven ability to work with behaviors and manage behaviors will really point to significant cost savings. And so the models will develop. Some statistics, and I can't give you the source exactly. It's a governmental source, but estimated that more than 7 of 10 presenting problems in a pediatrician's office have a behavioral component. And so a lot of what pediatricians are doing is trying to impact behaviors, and that's something that we know a lot about.
And in your background, you served as an executive officer at a capital advisor organization. So, you're looking at it from a business standpoint, and I think essentially that's what we need to do more and more in healthcare. Like with limited dollars, how do you use those dollars to help the patients in the greatest ways? And you see that there is potential light at the end of the tunnel here with some of the changes.
I do my best to see that. There's a lot of good conceptual work that's been done, but it's pretty heavy slogging in the trenches to get the payment mechanisms lined up in an efficient way. Many of your listeners, I'm sure, are wrestling with electronic records, and those are going to be essential to a lot of this integrated care. And we're really still struggling with making them as efficient as they need to be.
And I think even your present hospitals, I know from board meetings and things in the hospitals, they're still worried about, basically the inpatients and the procedures and the laboratory tests and all those different terms that they've worked on for so many years. It's hard to kind of shift a way that people are thinking. If you're just tuning in, you're listening to Primary Care today on ReachMD. I am Dr. Brian McDonough, your host, and I'm speaking with Robert Kreider. And he is the CEO of Devereux, and he is also here talking with us about a number of healthcare issues related to those who may have certain mental challenges and psychological challenges. And clearly, I know a lot of the work you do and a lot of the work that Devereux is known for is in the area of autism. So I do have some general questions. Again, I don't expect exact answers because I don't know if there actually are exact answers. But what is your latest understanding of why we have seen such a jump in the number of cases of autism? Is it that we're able to diagnose it better? Do you think it's something in the environment? Do you just think we're more aware? What's your take on it?
Well, as you suggest, there's not a clear answer. There is significant research. There's a major CDC project called the SEED, SEED project, which is taking a very comprehensive look at trying to understand better the environmental factors. At this point, all we can say is we're pretty confident that there are environmental factors. Not only are recorded incidents increasing, but there's also geographic differences. The incidence rate is much higher in both coasts of the United States. It is in the interior. Could be an environmental factor that differs. Could be a difference in the diagnostic approach with more of the psychiatric resources on the coasts than in the interior part of the country. So we do have pretty high level of confidence that it has a significant genetic component, and we know that through twin studies. And the incidents where both identical twins have autism or both do not gives a pretty clear signal that there is a significant genetic part of autism, but it's not the whole. The one that became the most popular was a linkage to vaccines, and fortunately, one of the things that's come out of the recent conversation in the popular press has been to have leading voices again make clear that there is no connection there. That is one of the few things in the medical world. We live with very few truths with a capital T. We have to find sort of operating truths, and for that, with the vaccine question, despite a 1998 study that was later found to be fraudulent, that indicated a strong connection, a very long series of studies, both in the United States and even more so in Northern Europe, where they had more consistent public health records, where they were able to look historically at the incidence of autism, both in vaccinated versus unvaccinated kids. And all the signals are very clear there that there is no relationship.
It's interesting how you mentioned, I do agree, the recent firestorm of publicity surrounding it has really served to educate the public more. We've done a couple programs on primary care today. We interviewed the bioethicist Art Kaplan, and it just in some comments that I made in social media, talking about the importance of getting facts right and understanding that the vaccines are important. They help prevent disease, and they're not linked with autism. I have never seen so much support for comments through social media. Like, I thought there might be a lot of people out there saying, oh, no. I really believe that the information, as you say, is out there, and people now understand overwhelmingly that there is an important need to get these vaccines for the general public health. But also, if you have a reason not to want vaccines, clearly it should not be a fear of autism. At least at this point, the studies are showing that and showing it quite conclusively.
I couldn't agree more. I was very pleased. There was a CBS study poll within the last week and a half, and it was very good to see that everybody was saying, no, everybody should get vaccinated. And that showed less fear than I've seen in prior questions. Everybody saw a physician, Rand Paul, made a statement which was interpreted as anti-vaccine or questioning vaccines, and he, within a few days, said, I was not suggesting causality.
Yeah, he had to backtrack pretty fast.
Yes, and I think people noticed that.
With Robert Kreider, we only have about a minute left. I wanted to ask you one last question. It's more or less a question just, career paths and what you've done. You obviously have chosen, you can do anything you want in the business world, you've chosen to work with Devereux, to work with people who clearly need that added support. Have you found it rewarding for you to be involved in this role?
After a career as an investment banker and a bond lawyer, it's by far the most important work I've done in my career. I'm very proud of the work we do. I have friends and extended family who've dealt with serious mental health issues and developmental disabilities, and I know what importance the work of helping the families, helping the individuals to maintain a level of independence and growth, personal growth.
Thank you for taking the time to join us. I really appreciate that. We run out of time, but I also want to let those of you know who are listening, if you missed any of this discussion, you can visit reachmd.com/primary care today to download the podcast. You can learn more about the series. I want to thank everybody for listening, and most importantly, Robert Kreider, I want to thank you for taking the time to join us.
Thank you, Brian.